Secondly, this presentation will have an outline where we'll discuss a little bit of the background, the basics on children, because many times there's a lot of assumption that everybody understands basic principles about children and financing. And we will go deep a little bit into the PET's findings, really about finance. And maybe we just want to paint a picture of maybe we have more resources than what we think. And that's what we want to present here. And then some recommendations from the findings and some of the critical reforms that the government of Kenya is actually undertaking that may be helpful for all of us. Before we do that, some basic questions. Maybe even before I go there. So who is a child? I asked this question. I was in a meeting and I asked this question to the cabinet, and I was actually surprised that only the president got this question correct. What is the definition of a child in Kenya? Anybody has the answer? I could be talking to the wrong audience. What is the definition of a child in Kenya? Anybody? I wish we had a mic there. It looks a very basic question, but to be very honest, it's a very serious one. Because I realized many people don't have that definition. So who is a child in Kenya?
0 to 18, a person who is 0 to 18 years old.
0 to 18. There are many teachers here. Did she get it or she failed? Sorry? She got it. Oh, she got half a mark. There is a marking scheme here. Yes, please.
I think a child can be defined precisely by the one who wants to define the child. But having said that, on the basic Kenyan Constitution, a child is a person under the age. Yes.
Okay.
And if you come to early childhood, you will discover we define the child differently. An individual who is dependent on others who are important around that person, and that person is below the age of 18.
Okay, so he actually got it right. The first answer, half a sweet, he actually got it right. So you have ticket for lunch. In Government of Kenya's definition, a child is anybody below 18 years. So not 0 to 18, below 18 years. The reason I raise that is it has very serious policy implications. And maybe this next slide will show it. If you have that on your screen, look at that pyramid on your left hand side of the screen. Unfortunately, the people in front don't have any screen. Okay? Now, basically, if you are not seeing, is the presentation up? Oh, sorry. I'm talking to myself. Okay, but maybe I will continue speaking. So I'll try to describe the pyramid. So we're talking about Kenya's population pyramid. It's okay now. Okay, for those who can see it, you know that pyramid is fat at the bottom, and then it goes very narrow at the top. And if you look at maybe the first 4 or 5 rows below that pyramid, it gets very fat. Basically, it is telling us that majority of our Kenyan population is actually at the bottom of that pyramid. I think my colleague said those are dependents. Now, I would like us to project Kenyan population 20 years from now. So I would like you now to take that fat pyramid at the bottom and push it up. 20 years from now, majority of those will be youths and adults. Now, if we don't invest in that fat bottom pyramid now, in 20 years, how will Kenya's economy look like? Because right now they are dependents, we're investing in them. If we don't invest adequately, in the next 15 or so years, that will be the population that Kenya requires for productivity. Now, if we have not prepared them adequately, then we are looking at a country that will not perform effectively. It's what we call human capital development. But if we invest in that bottom pyramid very adequately now, project our economy in another 15, 20 years, then you have a very highly productive economy. And at that time, I'm now 49, if you give me 20 years from now, I'll be about 70. So I will actually be relying on this population now to actually pay my pensions. If I don't invest in them now, I will have no pension when I'm 70. That's just the reality. And the population here, I'm not the oldest. So even just selfishly, please invest in this bottom pyramid. It's extremely important. Now let's move to the right-hand side of the slide. It is basically saying age at death by age group. So how many people are dying in the world by age group? And then the top one is developing countries, and the bottom one, no, the top one is developed countries, the first world, and the lower one is developing countries, where Kenya and Africa generally is. What is it showing us, those who are able to see it? 0 to 5 in the developing world. You know, nearly everybody is dying, colleagues, when they are 0 to 5. Now compare it with the developed world. There's no death. So actually, you and I are very lucky to be in the developing world, to actually to be here. You survived, Congratulations. Because that's what data is telling us, that majority of our young people, 0 to 5, in the developing world, over 50% are actually dying. So you will have a bullet ya kifo, And then just look at those graphs as you go up in the developing countries. There is death at every step. Now look at the developed countries. From 0 to around 35, there's actually no death. The developed world, people die when they are 75 and above. They have actually lived their world, their life, so they're actually just dying because of natural attrition. Now, what is it the developing world needs to do to actually mirror what the developed world has done? For us to limit those deaths, there's something they are doing. And I think the First Lady, the chair of the First Ladies, the spouses, spoke yesterday about taking care from age 0. Take care of the mother. I remember she talked about treating her as a queen. Then she talked about health, water, vaccination. And when the baby comes to this world, you know, them going to be delivered in a safe place, immunization, food, nutrition, family care. There's no death. That's what we need to invest in. But for you to do that, you need money, you need policies, you need partnerships, and I think that's what we are trying to create here. Children population in this country just to remind all of us, when you listen to generally government of Kenya's policies, you hear so much about youth. I will challenge you, when you live here, I give you one assignment. Please pick the budget statement that was read by the Minister for Finance for Kenya, Professor Ndung'u, in June. Please search the whole of that budget statement and get to me if there was any word children. But that budget statement had several layers of words youth. So there's a reality in this country that we speak about youth, and the definition of youth is basically 18 to 35. They are only about 29%. 50% of our Kenya's population is children under 18. But you don't hear that in our policy documents. It's not deliberate. And even now when you come into children, you really don't hear the issue of early years, which we define as 0 to 5, 0 to 8. You don't hear those things. And therefore, there could be a mismatch in our policy choices in the country because we are not being specific. But if you go to the right-hand side, you see the map of Kenya, and then you're asking yourself, so where are Kenya's children concentrated? And which regions have higher numbers of children as a percentage of the population? So when you come to the ASAL areas, including where we are, children are actually towards 60% of the population in ASAL counties. So if you took FCDC, including Turkana and so on, the children actually go above 50%. There are some counties where children are above 65% of the population. And then we will then go to the budget and say, okay, so if you have a population and that population 65% children, is your investment actually responding to the dynamics of that population? But when you look at the absolute numbers of children, then the Lake Basin and generally the highlands of Kenya in absolute numbers have very heavy numbers of children. Actually, there are about 6 counties combined in Kenya. When you put total number of children in those counties, Kakamega, I think Nakuru, Bungoma, Kilifi, and I think Nairobi, if I'm not forgetting, those 5 or 6 counties have higher numbers of children as compared to total number of children in all the ASAL counties. These are very important statistics that we need to look at as we continue making policy choices. Poverty, let's look at poverty a little bit. There are 2 ways in which we define poverty, and I think Godfrey was here and he went back. Godfrey is the guru of population statistics. We have what we call monetary poverty, basically income, money, what you use as a family per month, per day, on food, everything. And if you fall below a specific cut-off line per month, then you are considered poor. I think in rural areas, Godfrey, if I'm not wrong, average of about 3,500 expenditure per month, then you are considered poor. In urban areas, it's about double that. It's about 6,000 expenditure per month per family. Now, when you take that, on average, we're talking about 33.3% basically of families living in poverty. But I would like you to understand that Kenya is actually reducing poverty. If you look at where Kenya was in monetary poverty in 2009 compared to now, from 45% in 2009 to about 33% right now, you are talking about a drop of 12% in poverty in about 10 years. So per year we are dropping maybe around 2% poverty, which is not bad, but we can accelerate that. But the best measure of poverty is not really income poverty, but is what we call multidimensional poverty, which is basically a combination of the services that a child, a human being requires put together. And if you lack 3 of this, then you are poor. And this becomes extremely important in the work we are doing. So if you lack health, water, for example, nutrition, combined together, and you are below a cutoff mark, then you are considered poor. So we said monetary poverty is at 33%, but multidimensional poverty is actually 50%. That is average of our country. Okay? So Kenya is poor. Let's not pretend. If you have 50% of your population poor, you are a poor country. Okay? That is the reality. However, the positive story is that multidimensional poverty has been reducing. In 2009, it was actually close to 70%. So you can imagine 70% of Kenya's population in 2009 was poor. Okay? But right now, we're at 50%. So we have dropped by poverty by close to 20% in a period of 20 years. That is a huge drop. So congratulations to Kenyans and government of Kenya. And actually, this period can be mirrored to devolution. So if you want to ask yourself whether devolution is having an impact, an answer is here. Income poverty is heavily families. Multidimensional poverty is families and services of government. And you can see the drop of multidimensional poverty is faster than income. The difference is the impact of government. So government is having effect, but despite that, we are still 50% poor Kenyans. Now, our vision is up to Vision 2030. We are now 2023, 7 years to Vision 2030. We need to accelerate poverty reduction quite heavily. Now, how are we doing that is the big question. Now, is government spending right when it comes to its targeting resources to reduce poverty? Now, indulge me just for 1 second in this. So, we've talked about children who are poor multidimensionally between 0 to 17 years. So, look at the concentration of poverty. Sorry, there are some people who can't see the map. But look at the poverty generally in the ASAL regions, including where you are. And this is for children. Mandera, 90.2% poverty. So if you take 10 kids in Mandera and you line them here, 9 out of 10 will be poor. Okay? That's not a very good thing. I'll come to Turkana where we are. So if you take 10 children in this county and you put them here, 86%. So 8.6 children. There is no 0.6 of a child. So you take the 0.6, you put to 8, those are 9. 9 out of 10 children in this county, if you put them here, they'll be poor. That's the reality of our ASAL counties. So what is the message here, colleagues? We have work to do. And ECD is one of the biggest avenues for us to come together to concentrate our partnerships and money, to be very honest, to reduce this sorry state in this country. Let's not pretend our country is not doing well when it comes to poverty. We could be spending money, but are we targeting it? Now, leave alone the poverty situation. Is government expenditure pulse-wise responding to the issues I'm talking about? The big answer is yes. That government expenditure policy is actually pro-poor. And how do we look at that? We look at the correlation between concentration of money to regions where people are poorest. And evidence is showing us that per capita, if you take the total government expenditure in one basket, and then you divide it across the population, and you put it in counties, The per capita spending in the ASAL regions where there is high poverty is actually 4 times the per capita spending in regions in central Kenya, Lake Basin and so on, which have less poverty. So government is actually targeting the resources effectively. The big question is, why is poverty not reducing as fast, even with high per capita spending in the regions where there's high poverty? So is it efficiencies? Are we not concentrating our efforts effectively? Is the money not going to the underlying reasons why people are poor? Those are the big questions we need to ask ourselves. Now, let's look at now the proper public expenditure tracking survey. What is it telling us, pasted on that background? So, what is the biggest rationale as to why ECD is important? And for those who can see the slide, the answer is here. Investing in children in early years has the highest return on investment. And I think from yesterday, that's what we have been hearing. So actually, if you put your 1 Kenya shilling to children below 0 to 3 years, for every $1 you invest, that would be about 140 Kenya shillings. For every 140 Kenya shillings you invest, you return 17 to 24 times what you have put there. So just put in $1, you will get returns of between 17 to 24 US dollar. You can do the maths when you invest between 0 to 3 years. And the rate of return on investment actually reduces significantly as you invest in older age people. So for example, it basically says you better invest in ECD, you better invest in primary education, secondary education, and invest less in higher education. What do we do in Kenya? Nearly all bursaries, all loans, etc., we concentrate to universities. Who goes to the university? Is it the poorest kid in Turkana who is facing insecurity where the governor was to? Is that kid going to go to the university? I highly suspect not. But if you provide money to that kid in that condition at that lower level, there are very high chances that you will actually get the best of that child as they grow up. So colleagues, policy-wise, whether you are national government or county government, let nobody cheat you. If you are an MP, if you are an MCA, and you have a basket of bursaries, school fees, please do not concentrate your bursaries to university students as compared to children in the lower ages. You have higher returns to the economy when you put your money towards the young ages in education. We are not saying you should not support children going to the university, but please balance the bigger cake, put it in ECD, in kids in primary schools, etc. Count after 20 years and come back here in Lodwar. You will see the results. Now, what does the public expenditure tracking survey tell us specifically? I think I've already mentioned the poverty rates in the country. I will not talk about it. But early years, and this study we did not pick 0 to 5, we picked 0 to 8 for some reasons. Basically, we are talking about 11 million children in this country who are 0 to 8 years. Kenya's population is just 50 million. You're talking about 11 million children, 0 to 8 years. That is significant population of the country. But let's look at how much are we investing in that significant population. So public spending for ECD services in Kenya is quite low. You know, it's just about 0.9% of total spending. And it's just 0.4% of our total wealth of the country, which we call GDP in economics. So as a country, colleagues, we are not investing our resources in the population that matters most. Let nobody cheat you. When you do analysis of social sector investments, you pick health, education, etc., it will give you a very big figure of about 42% spending of county governments on social sectors. But when you go down and you start saying what is ECD, that shrinks from 45% to 0.9%. We are doing poorly as a country, I'm sorry to say. Now, the positive message is the ECD budget trends, however low they are, from 2017 they have actually been going up. So there is a positive story there. From about 38 million to about, billion to about 46 billion. Consistent going up. But the big finding within that, ECD is malsectoral. Where is the majority of that little investment? I was thinking personally when this study started, I thought it was going to be health. But to my surprise, it is actually early learning. It's taking majority of the investments. Water and sanitation comes very closely. No, not very closely. It's about 25%, 25 billion in terms of early learning, just about 8 billion in WASH. And then surprisingly, I thought health would really come tops. Health comes a distant third at 6 billion in terms of spending. And then social protection just about 3 billion. And then, colleagues, the big worry is there's nearly zero investment in nutrition. Nearly zero investment in nutrition. And what have we been told by past panels? That the first 3 years is where a child's what? I remember Daktari spoke very ably. And that's where we are putting zero money. Now, we are investing money in health, but what matters most, nutrition, is nothing. We are actually killing the brains of our generations. And I always joke saying maybe the reason why my head is flat is Luyas fed me too much ugali. So this is something of concern, colleagues. Directors of budget, directors of health, CECs, the Minister for Health, etc., there's no money in nutrition in Kenya. It's a bit worrying. But what is the source of funds for these investments in ECD? For me here, there's a very positive story. That actually majority of the investments in ECD is local resources. It's not aid. In this country, people think aid is extremely important. No. Kenyans are actually financing their own development. Aid is only 0.3% of Kenya's GDP, and it is only about 10% of annual budgets. Kenyans fund 90% of annual budgets in this country, which is something very positive. However, within that, there's still a problem. When you look at user fees, whether it is in health, ECD, education, whether it's in WASH and overall, this thing of user fees, basically a family, a mother, a parent going to a facility and they have to pay for something. It is still very significant. You look at early education, out of the pocket is actually 31% of the funding of early education. It's, and I'm a poor mother, father in Lodwar, facing drought. I spent of the cost of ECD out of my pocket. It's too much. We need to do something. In WASH is 17% out of the pocket. Health is 9%. So counties are actually squeezing in health. Well done, we need to continue doing that. But the big message here is out of the pocket is still quite significant. And the picture of poverty, KDHS, Godfrey. Positive story here. If you are seeing the screen, all the indicators from KDHS, skilled birth delivery, immunization, malnourishment and stunting, wasting, Antefertile mortality, infant mortality, FGM is green. So basically, the indicators are actually improving. So the quality of life of a child in this country is actually improving. However, there are some indicators like breastfeeding, malnourishment, and therefore wasting. They are still stagnant or actually performing poorly. But the big message is, despite those challenges, investments are actually having impact in the country. Then nearly second last, I talked about, so where does money come from when we speak about ECD financing? You know, a lot of people will basically think it is county government, is national government, Ministry of Health, Ministry of Water, and so on. But there are so many pipes. Like if we took Turkana County and we comprehensively start saying what are the resources available. And these directors of budget, ECD directors, and so on, please be aware, there is a lot of money from different pipes. So if you put a child to be this chair, and then you said, okay, so what are the services that this child needs? You will need a pipe of water, a pipe of health, a pipe of nutrition, a pipe of care, a pipe of protection, etc. So those pipes are feeding this child. So you go to Treasury, and then you start tracking money through those pipes to this chair. And then you start asking ourselves, beyond government money, what other pipes are actually funding the health of this child? Family is providing some funding, development partners, etc. Then you start asking yourself, okay, in government, people will talk of education, health, etc. But that's not all. There was an MP here. Turkana County has how many MPs? 6, 7. Each MP is controlling how much CDF? Roughly? It's about 150 million now. Do we engage them to actually partner with us on things that interest them to grow this capital? So there's a lot of potential for resources. What is the strategy for us to tap into those capacities is the challenge I leave with us. What were the findings? Quickly, I think this was already mentioned. ECD spending per child in Kenya is just about $81. Okay? Kenya is the superpower in terms of economy for East and Central Africa. Okay? It's the superpower. But that superpower is investing in ECD half of what our neighbors are doing. We are rich. We are investing 50% of what Uganda, Tanzania, etc. is doing. Why are we doing that? We speak, we don't act. We have not internalized how important this is to our economy. So this is a reality we need to face. We are doing poorly. Now, 93% of ECD spending comes from our domestic resources. So I think I mentioned that. That is something to be proud of. But, colleagues, 30% of what is meant to go to ECD does not arrive at the spending units. So the money which leaves Treasury to come and provide vaccines or immunization to a child in a dispensary in Lodwar, 30% does not arrive. So for every 10 shillings, 3 disappear. For every 100 shillings, 30 disappear. Within these pipes, where does this money go to? How do we seal those loopholes? It's a big question. You can imagine 30% does not arrive. It is somewhere in the pipe. Where does it go to is something we need to look at. Now, 40% of facilities that provide ECD services reported not having or seeing their approved annual work plan. So I'm a nurse seated in a health facility to provide immunization, maternal services, etc. and I have no idea about the work plans and the approvals of money and what money is coming to me. I have no idea. So I just operate in darkness. So I am at the whims of the mandarins up here. Who understands these things? Who is supposed to generate those plans? So the director budget, where do your plans come from? You sit with your colleagues and you generate plans? Where do the procurement plans of the hospital facilities come from? People are saying they have no idea about their work plans. So where do we make our decision from? You know, and then heavy delays of supplies. So I need vaccines, immunization, etc. KEMSA with its stories. Delays. By the time I receive these things, kids have missed immunization and so on is a reality. And then the issue of timely information is a big issue. And then public financial management staff, so basically accountants and so on. It's a big gap at the local level. So human resources is still an issue. Yes. Now, what are we recommending out of this study? So efficiencies. If there is one thing I would leave with us, please, efficiencies. And how do we get efficiencies? Working together, common plans, knowing that we have limited resources. What are the resources available? Get together at the county level, at the facility level, and then focus on efficiencies. And then this intersectoral, you know, working together, committees at the local level, at the county level, you know, the governor and the county commissioner coming together on these issues, extremely important. And then finally is, I think, what Maniza said yesterday from Conrad Foundation. Please don't ask for an ECD budget line. There is nothing like that. It's about services that a child, a mother needs. What is it? It's health, it's water, it's nutrition, it's immunization. The colleagues in Treasury, those are the lines they understand. Don't go to an economist in Treasury or here at the county government and you are saying I need an ECD budget. No, they will not give you the money because they don't know what that is. They will end up giving you money, ECD, they will tell you it is education. Go to them with the services, and therefore you need to understand what the services are, and then the budget lines will come. So finally, so having said this, what is the government doing at the high level that will have some significant impact on what we are discussing? And these are some of the reforms that UNICEF plus other partners are doing. Maniza mentioned the budget costing. So as we speak, Treasury has just kicked off a huge assignment of budget costing for what we need in this country in every village for each service. So very soon you will actually get a full budget costing with guiding manuals. So you know very well this is what I need as a baseline to provide services. UNICEF is providing that support. Treasury is coming up now with a budget portal. In the next maybe 6 or so months, you will be able to see a map of Kenya, and if you enter that map, you will be able to track ECD budget from Treasury to the village. It has done what? Is it a needle? Is it a medical doctor, etc.? You can query the system and say, I need expenditure in Lodwar Town on health, water, sanitation, etc., and that system will be able to tell you. CIDP indicators handbooks. In Naivasha next week, UNICEF is supporting the government. Turkana County is part of those, to actually generate indicators handbooks for the CIDPs. But the most important thing about that assignment is the critical indicators around ECD that you will be able to track in a system, and we're asking the governors to have that as a portal in their office, so that when the governor who was here yesterday enters the office, they're able to see on the screen the indicators and how the county is performing, and they're able to query the ECD and so on. Social protection, there's a map that is coming up. And then public financial management reform strategy for the whole country, anchoring service delivery as a very big pillar. Automation of county statistics, Godfrey is there, including here in Turkana. Big support is coming on a fully automated KNBS type of office here that will have abilities to give every stakeholder data here. And then, of course, KDHS, and now Mix is coming up, which will have a full component on ECD as we go forward. We don't do this without support of partners. We really appreciate these partners. Manisa and Conrad Hilton Foundation, thank you for your support. Portugal, and out here, Bill and Melinda Gates, and then the governments of Sweden, Finland, Italy. And then we do have our colleagues from Expertise Global. My brother, please if you just stand up for 1 second. As professionals in UNICEF, we bring in these experts to support us with this analysis. We do appreciate that. Thank you very much.
Can we give a more coordinated round of applause to Daktari? I'm requesting that we give a more coordinated round of applause to Daktari. Aya, 1, 2, 3, fungua. Fungua. Funga. Thank you so much. At this juncture, we want to appreciate Daktari for that powerful presentation, and we want to welcome at least 2 questions from the plenary. 2 questions. The mic. The ushers, are you there? Yeah, give the mic to her. Naambiwa ukue brief.
Thank you for that wonderful presentation. I just have one concern. Yesterday when I came here, the chairman for the COG said that there is 5 billion which will be given as capitation for ECDs. But from your presentation, I thought that this will be based on analysis. Why I'm saying so is because you will find that in Nairobi, most children are in ECD, in private ECD centers, and the number in public is very low. But when you come to my county in Migori, you will find that there are so many, over 100,000, and yet the finances, will this be based on analysis? So it's more of a comment that as we do this ECD funding, we base it on very clear analysis, and this is where I will request economics to come in and assist us as counties. Otherwise, where will we base our lobbying for this ECD support from? Thank you.
Thank you so much for that question. I'm informed that there is a participant online. Are we able to connect her? The support desk? Okay. As we wait for that, any other question? Any other question from the back in case I can't see? Okay, there is one here. Waziri? Please have your mic on.
Thank you very much for that great presentation. I was willing to continue listening for another 1 hour. But I'm having only one concern, that the Republic of Kenya is one of the states that has highly qualified economists who could inform those who are preparing the budget to ensure that we invest on high returning areas rather than throwing money to any other part. So I'm now questioning our economic advisors in both the county and the national governments. I don't want to mention names. That why are they not able to gain and understand which areas will drive this nation fast and make it a first-class economy, rather than just to wherever someone would think money should go. It's high time this country picks people of better integrity, not just an economist by name, so that we deliberately push our finances to where we can harvest and not to where people can harvest in their pockets. Thank you.
I think that was more or less a recommendation than a question, and thank you so much for that powerful statement. It is the questions and the responses that is standing between you and your lunch. I think due to public demand, let's have one question, then we'll have Dr. respond, and we'll finalize. Thank you.
Thank you very much. My name is Joseph Elu. I want to ask a question based on the statistic that Terry has presented. He says that 90% of children in Mandera Yeah, 8.6 children in Turkana are under poverty. Considering the fact that the economic backbone of the two counties is pastoralism, what will be the space of a pastoral child in economic analysis that you have just presented, considering that most of the allocation in Kenya is either driven by political affiliation?
Yeah, thank you so much. You'll allow me to give Daktari time just to respond to the questions. If you have more time, then we'll give another round of questions.
Godfrey, this is your area, my friend. This is a guru. All these KDHS we see in Kenya, the mix and so on, this is the brain behind. Godfrey Ndenge has been one of the top economists in Treasury, so he would be responsible for misadvising the country.
Good afternoon. I think I want to respond on two aspects of the questions. The first one is on numbers and statistics. And my is that as Kenyans we have no respect for data and evidence. And I have all the evidence to say that. One, we don't invest in data, we don't invest in statistics. And when we see statistics, we don't believe them. We are together? Are we together? And I can give you a very quick example. Those who are from education, and there are very many here, how do you allocate the capitation grant for primary and secondary? Based on numbers, enrollment. But enrollment numbers and statistics are only out 4 years down the line. The latest is 2020, and you have already allocated capitation grants for primary and secondary. For this current year, how did you do it? Are we together? Now, listen to this. In Kenya, if I wanted to send someone money in Turkana or in Wajir right now, they are stranded, I can send them 500 bob and they'll get it right now. Are we together? Now, enrollment, how do you collect those statistics? You don't need any effort. The teacher is already there. You mark a register, and on a daily basis, you have those numbers. How come that those numbers arrive in Nairobi to help us allocate resources 4 years down the line? So the latest EMIS report is for 2020. But you are already allocating resources for capitation for 2022 and 2023. What did you use? We have no respect for numbers. Let's go back a little bit. That's why Dr. Simiu said we are out to automate statistics in every county so that these numbers are available. If that teacher in every primary school send those numbers, you will get the enrollment in every class, every Friday, every month, ready to allocate resources. Are we together? So technology is there, it's so easy, but we don't do it. We have no respect for numbers. We need to begin to give respect to evidence and its utilization. Now, let me go to Turkana here. How do you allocate your budget for water? You divide it across the 30 wards. Do we have people from Turkana here? But is that equitable? So the poorest continue to be poor, so you allocate resources to sanitation, to water, just by 30, politics. So politics sometimes overrides economics. So when you ask why are treasury people not allocating resources according, even here, because of politics, which overrides economics, you find that budgets are allocated according to other bases but not equity. So there are counties, sub-counties here who need more money, but they get the same as those who don't need. Are we together? We need to begin to give respect to equity.
Yeah, thank you, Godfrey. I repeat, Godfrey Ndenge looks very small, but if you want any data in KNBS, you want any, this KDHS you are talking about, that's the brain behind it. You want any financial links between poverty and how you spend money, that's the brain behind it. Godfrey Ndenge is my colleague. I lead on public finance, he leads on poverty data. Now, my colleague who asked from Turkana County the opportunity of the pastoral child. And the drought, we know, 40 years, we are told this has been the heaviest drought Kenya has experienced. Now, my brother, I am suspicious that if Godfrey and I started doing poverty analysis in Turkana today, that number from 8.6 would go to 9 point something. Okay? Drought has impacted wealth. Actually, Godfrey says there's new poverty in Kenya, livestock-based poverty. But that's not the point. The big issue is what are the drivers of poverty in Turkana County? And our analysis shows that the big drivers of poverty in Turkana County is, I think, housing, water, nutrition, and sanitation. So if I'm the governor of Turkana who was seated here, the big question I would ask my CECs and the CEC Finance is show me how the budget is responding to the biggest drivers of poverty. And if you don't have that answer, if today you gave me that position of the governor, you will not be in my cabinet. It's as simple as that. Because you are not advising me properly. I need to support my people. The biggest driver is lack of nutrition. Turkana budget, if I went in today, sorry the CEC Finance is not here, I would have told him off. There is no nutrition budget in Turkana County. Malnutrition is the biggest driver of poverty in this country. That's not where we are putting money. So where are we putting money? Based on what? Would be my answer. And until we have this type of discussions and make policy choices that is going to help our people, then we'll continue getting our development wrong. And that's why Turkana County has one of the highest per capita budget in Kenya. Poverty is not reducing in Turkana County. The answer is there. We are not putting money on the things that are driving poverty in this county. It's as simple as that.
Thank you so much, Daktari and his colleague. Ladies and gentlemen, from this session, it is clear that we are not doing things right. There is need that we start investing early. We have also been informed and we are aware that there are several untapped funding opportunities for ECD. Ladies and gentlemen, just to summarize, we have been told that there is data indicating the impact of investing in early childhood development. You can refer to Professor Hetman, who talks about investing $1 with returns of how many dollars? 17 Hello? 17 We have also been challenged about income poverty and multi-dimensional poverty. It's interesting that we've been talking about ring-fencing ECD funds. But in the event that that is done, where do we invest it in? Where do we invest it in? We have been told that majority of that money, a greater percentage, goes to early learning. There is very little that goes into WASH, and you can relate the impact of not investing in the field of WASH and how it impacts on ECD outcomes. There is also the fact about social protection, and it's very discouraging, ladies and gentlemen, that we know the impact of brain development and how nutrition is related to this. But out of all this, how much goes for nutrition? Hello? How much goes for nutrition? Are we ready to go for lunch? Hello? Allow me welcome Oscar to guide us for the next steps. Thank you so much, ladies and gentlemen.
Thank you. A big clap for Tobias. Please don't move. Just remain seated where you are. That was not clapping. That was just shaking your hands. So can we clap? There is lunch. Can you clap better? There is better lunch. Clap. I want Daktari to just clarify one thing, because we also are looking for homegrown evidence. Sasa, just one thing about that 17. Was it from there or where?
Yeah, no, that's our own analysis, of course, which corroborates what Heckman is saying. Yeah, so from both the costing, expenditure tracking, but also what we call returns on investment analysis. That's the figure for Kenya. But it corresponds very heavily to what Heckman is saying.
Thank you. So finally, we have Kenyan data. You can now quote officially. Amani, did I say right? You can quote that this is Kenya, because we use the Heckman one because we have always been looking at a global standard. But now we have Kenya. Now that does not really speak very well to what I want to say. This afternoon, we are going to have 2 breakout sessions. Those breakout sessions are the ones that were meant to have happened, one at 11 o'clock and the other was meant to happen in the afternoon. So what is going to happen is that we will go for lunch, and then post-lunch, that means after lunch, we will go to the breakout sessions, so that we will run the first concurrent session the first hour. That will be 3 to 4. From 4, hallelujah, nikisonga hapa mimi ndio nakuwa na shida ya mic. From 4 to 5 we will do the last one. Now county teams, your presentations are happening first thing tomorrow morning. We are giving you a 2-hour slot. Please prepare your presentations, and those presentations should actually follow what we have just heard here. Don't give us presentations on the number of classrooms you have built only. That is not why we are here. We want to go beyond that. So please call your counterparts and ask them for data on these other areas. Godfrey has just said we need more. Ndio tuweze kusikia mambo yote kuhusu mtoto kwa huu mkutano. Sasa na ninajua kwamba tuko na a lot of data. So my request is, we are giving you 2 hours as counters. So what did I say? We are going to go for lunch. Then after lunch at 3 o'clock the sessions begin in the various halls. And this is how it's going to be for lunch. Now we have given you meal cards. Only guests, those with meal cards labeled guests, should go to Neema Hotel. We are having a situation where the guests are, the CCs, the CEOs are arriving together with the CEOs of entities, and they are arriving there and finding that they can't even get seats. Please, Neema is reserved for you if you have a meal card with the name guests. And if you want me to spell it, it is GUESTS. You and your guests. And then all the others who have the different meal cards, please come to this point. And I think there's a session that will also, a section that will also have a small group, particularly those in the security team, that will be having their meal next to the restaurant. So kindly, our lunch begins now, and by 3 o'clock, chairs of the various sessions. Session 1 that is meant to happen will start from 3 to 4. and then we stop and get into the next session. Please look at your program and make sure you know where you want to be. Asanteni sana and enjoy your lunch.